Congresswoman Jackie Speier became the face of the women's health debate in February when she shared her personal story of having had an abortion with fellow House members on the floor. Congresswoman, great to see you. Let us put this in some sort of context, because it seems as though, as the women Democratic senators were saying, how does this all come down to being about women's health again?
Unbelievable, isn't it, that we would bring this government to a screeching halt, prevent members of the military from accessing their paychecks because of contraceptive pills. That's what it's really about at this point.
Well, if we could try to put it in context, Planned Parenthood is one program. I mean, it's a teeny part of the federal budget. So how does this get to the larger issue of cutting spending, where Democrats have frankly been behind the curve as far as the original, budget negotiations? They certainly have had a lot of catching up to do.
Well, there has been some catching up, and we have caught up. We have agreed to 70% of what the Republicans have asked for in terms of budget cuts. And from the perspective that we are standing at now, this is all about trying to turn back the clock on women's health. Planned Parenthood provides services to about 7 million women a year: breast cancer screenings, pap smears, making sure that women aren't coming down with cervical cancer, offering contraceptive pills. All of those services are what is funded through this $300 million appropriation, and that is what is preventing us from moving forward and preventing the shutdown.
I've been told that there are some other issues, some of the other social issues that the president was willing to compromise on, but that this was one that he absolutely said was veto bait. He was not going to agree to anything that included the cuts for Planned Parenthood. So this is really a divide. It's a gender divide, and it's also a divide between most Republicans, I should say, and Democrats, at least on Capitol Hill.
Well, but even during that debate in February, many Republicans stood up and said, they support family planning. There are a number of Republicans that voted with us against the family planning services provided for Planned Parenthood. This is all about getting to the abortion issue, which is not an issue because there's no federal dollars that can go for abortions. And yet, it's important to remind everyone that abortions are still legal in this country.
Where do you find the gap in terms of the way many women, not all, but many women respond to these issues, and many men?
Well, the gap appears to be, religious in basis, certainly, but I don't know that there's really a gap when it comes to family planning. I mean, if you ask most of the women who serve in the legislature, in the House or the Senate, they've used birth control pills in their lives. This is making sure that women who are poor can access birth control pills. Most women have gone to their annual checkups for breast cancer screenings and pap smears. This just allows poor women to access that same service.
Congresswoman Jackie Speier, thank you very much. Thanks for joining us. A tough day up there on the Hill. And